mission of respect for people, meeting people where they're at, nurturing life, even in times of real sickness and distress, is still lived out in this hospital.
I would like to see Mount Alvernia as an affordable hospital who serve all with love and care. They want preventive health care, and that has become very important.
Our key focus in the past has been really maternity and pediatric care. But looking at the general population trend in Singapore in particular, we will move forward to look at the needs of the aging population and how we could support the needs of such a population from a hospital context. Moving forward really is for patients to have more information and knowledge on what's happening in their recovery process. This is important for patients so that they can have better ownership and better empowerment to actually help them expedite their recovery. We are looking at having holistic care and providing the whole spectrum of care in a very integral and wholesome manner to our patients. In terms of science and technology, we know that that's ever evolving so they can offer the latest medical treatments to the benefit of our patients.
Obstetricians' play has changed. We used to be just only interested in doing deliveries, and now the scope has changed. We are there to support them and to care for them and see that they go home with a healthy baby in their arms, knowing that they have got a rich, joyful experience in the hospital.
As science develops and as society becomes more sophisticated, there is an increasing demand for us to be able to deliver care in a less invasive manner. A multitude of tools that we have, sophisticated means of cardiac imaging, which allows us to have as accurate a picture as we can of the heart and the patient so that we know precisely what we're dealing with before we actually even consider doing something invasive.
We see nurses forming the backbone of the hospital. Mount Alvernia, for the nurses, will represent a place where they can feel very comfortable. It's drawing back on the culture of Mount Alvernia, how it first started as a missionary hospital. And for nurses, a lot of them enter the profession because of passion. And that is very, very similar to how the missionaries set up this hospital way back in 1961. So I think along with that kind of similarity and familiarity, the nurses would feel very much at home at this hospital.
In Mount Alvernia, we work as a team. In maternity, not only in your ward level that you help the patient, it does also sometimes involve other departments, such as some doctors will order to put on a testosterone where we need a physio staff to come in. We have from the parent craft center so that the make a difference on the patient outcome.
Whenever a doctor orders any treatment for the patient, we have to collaborate with the doctors. As nurses, we also have to think of the effect of the medication. Nowadays, we are sending more and more nurses for advanced diploma course to train them up and give them more in-depth knowledge on how to handle patients.
I hope the hospital continues to grow and flourish, and this unique gift that we can offer the people of Singapore will continue. So many people are so specialised. We're privileged in Mount Alvernia to have a pastoral care department where people can offer whatever the person needs. Doesn't matter what race, what faith, what religion. We treat each person with the full dignity as a human person. And whatever they need, we have the privilege of having people whose full-time job it is just to be there for them. Our Franciscan mission can be summed up with everything we do through Mount Alvernia Hospital: to serve all with love.